So thank you very much for joining us. A quick agenda for what we're going to do. I will spend a couple minutes at the beginning just to explain to you what the forum is, what our Queen Elizabeth Scholarship Program is, and then I'll introduce you to each of our 4 presenters, all of whom traveled abroad in the fall and had wonderful experiences, which you'll hear about today. We will then do questions for everyone, so we'll do the question period at the end of all 4 of their presentations. And then once that's finished, I'm going to tell you a little bit about our new Queen Elizabeth Scholarship Program, and then we'll move into the other room and have some refreshments, and you'll have a chance to ask our scholars questions about their experiences further. So come on in, have a seat, and we'll get started. So the McMaster Health Forum is the leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, and prepare action-oriented leaders, and work as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the forum, our Queen Elizabeth Scholarship Program is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health systems leaders. We have had 3 cohorts of scholars so far. Here is the list of our first group of scholars who went abroad or visited us primarily in the calendar year of 2016. We saw an influx of applications after that first group, and so here's our second group of cohort, our second cohort, which was in 2017. Our 4 presenters today come from this cohort. And our last cohort in this particular Queen Elizabeth Scholarship Program is cohort number 3. We have a number of incoming scholars who will be visiting us in the summer, and then mainly undergraduates who will be traveling in the summer and or the fall this year to conclude this version of the Queen Elizabeth Scholarship Program here at the McMaster Health Forum. Our first presenter today is Abeera. So Abeera is an undergraduate student in the Bachelor of Health Sciences program at McMaster University specializing in global health. Because of her diverse interests, she aims to work at the intersections of disciplines to solve challenging health problems. Abeera interned with the Sachs Institute and was based at the Menzies Centre for Health Policy at the University of Sydney in Australia, where she worked on the Population Health Information Management System, which we're all excited to hear a little bit more about. So I'll turn it over to you, Abeera. So if you could just grab one and hold it.
Hi everyone. I think it's working. So today I love obscure titles, so I'm going to start with connecting the dots, and hopefully that will make more sense by the end. And I went in the fall, and so I'm briefly going to talk a little bit about the host institutions that I was at, give a little bit of background on the project, and give some personal insights, and then briefly touch on some personal adventures as well. So this is kind of odd because it says I went from Vancouver to Sydney, but essentially what happened is I was sitting in my office, I was working for a health tech startup in the summer, and I got an email, and it was from James, and essentially it said, hey, do you want to go to Australia? And I was really like, oh my goodness, I don't know what to do, because I had originally planned to go be abroad this semester, and I was really indecisive originally, and after consulting a range of people, I was like, perhaps this is a good idea, and in the end, it all kind of came together and made a lot of sense, although there were a lot of little challenges to get there. So I'm going to tell you a little bit about the institutions that I was interacting with while I was in Australia. So the first of all is the Sachs Institute, and essentially the Sachs Institute is about bringing research evidence into policy making at a high level in Australia. And then within the Sachs Institute, there's something called the Australian Prevention Partnership Centre. And their focus is about bringing a range of stakeholders together to figure out how can we build a prevention system that is about reducing chronic illnesses and addressing lifestyle chronic illness diseases and that burden. And at the end of the day, I was actually based at the University of Sydney at the Menzies Centre for Health Policy, which is simply a research institution focusing on policy innovation and implementation. So you can see that it really takes a lot of different institutions to make these placements kind of possible, and so it's not just a one group process. So now actually getting into some of the background around the project and the things I was working on. So while I was in Australia, the New South Wales, which is a state in Australia similar to Ontario, one of the priorities of the Premier is addressing childhood obesity. And so this resulted in the largest ever rollout and funding of childhood obesity prevention programs known under the suite of Healthy Children Initiative. And the goal of these programs is really about improving physical activity and a nutritional environment in early childhood services and schools. And the way they did this is by getting these schools and early childhood services to adopt healthy practices or policies that are evidence-based. For example, having a healthy snack break or a designated water break during your time within the school day would be an example of a healthy practice or policy. And this is delivered and organized by health promotion officers that are located in each of the 15 local health districts across New South Wales. And so essentially, health promotion officers work with these schools and childhood services to get them to adopt these good practices. However, this is a big process. So since this was the largest funding of the program and a big rollout, the New South Wales Ministry actually invested in creating a whole new platform called the Population Health Information Monitoring System. I'm going to refer to it as PHIMS, and this was to track the implementation of the program. So in the system, the local health promotion officers can report on each school and how they're doing in accordance with these practices or policies. So they would tick boxes for, yes, the school has X amount of physical activity, yes, the school is doing this. And it's a way for them to organize their work. And what was really cool for me in this sense was while I was at my job in Vancouver at a startup, I was actually using a platform that was quite similar to PHIMS. I was on the sales team, and we used to track our clients and get them into the pipeline and sort of track them using a similar software. So when I got to PHIMS, it was like, oh my goodness, I thought I was like almost meant to be there. And it was this idea of connecting the dots that I wouldn't have anticipated otherwise. And there are a lot of different things that PHIMS does. So, you can do some contact management, some email notifications, and also the aggregate data from PHIMS is used at the ministerial level to inform policy and to see how we're doing on progressing on program implementation targets. So PHIMS becomes pretty central, and also it's important to note that PHIMS is quite new. So we have electronic health records in like clinical care and things like that, but for something like prevention, electronic systems and having them is quite new, which is why our team was interested in studying this system and how it interacts with health promotion. And another thing to briefly mention is that this project was actually involving a lot of different stakeholders. So there was a researcher, which was the team that I was working with at the University of Sydney. There's the policymakers who are the ones who created the program, the Healthy Children Initiative, and the PHIMS platform and technical team that are based at the New South Wales Ministry of Health. And then there was the actual practitioner, which is the health promotion officer on the ground, actually implementing these programs. So all these different people kind of come together when we try to study such a platform and in the delivery of these programs. So the broader question that our team was really interested in was how does an electronic monitoring system kind of interact with the day-to-day practice of health promotion? What are the implications of bringing monitoring into health promotion, since this is quite a new phenomenon? And so the broader aims I'm going to briefly touch on is looking at how is this platform being used in the different contexts, sort of what does it take to get a school to even adopt these practices and policies, and how does that look like in terms of data into PHIMS. And then, funny enough, we also wanted to look at what are people doing outside of PHIMS. What are the tools that people use, whether that's spreadsheets or sticky notes or other things that they use besides PHIMS. Then we wanted to look at how technology is interacting in terms of the process of practice. What does it say about the values of the people using the technology, the health promotion practitioners, and then also how is it in general impacting the field of health promotion. The reason why the third one is highlighted in blue is that this is what I ended up kind of focusing on. So the project is kind of, like I said, a little bit complicated. We have these childhood obesity prevention programs. We have the platform PHIMS, which is used to sort of in terms of implementation and tracking implementation. And then now I'm looking at what's happening outside of PHIMS and what are people using outside of this platform to inform their work. So it's a little bit of a dynamic process in that sense. And so how do you even look at something like a technology piece? So when we got into the methodology of it, what was really interesting to me is the idea of ethnography. It was not something I was not familiar with at all. So ethnography is essentially a methodology that's based out of cultural anthropology. To study culture. So essentially what it involves is people actually going in and observing and interacting with one's environment in order for collecting data. So what happened is before I got there, my research team had spent time with health promotion officers on the ground. So they would go in, spend a couple of days with the health promotion officers, get to see how they implemented these programs, how did they use PHIMS in their day-to-day practice, and essentially what the data looks like is a series of reflections and stories in the form of field notes that document the researcher's experience interacting with health promotion officers. And this is to me, was quite a unique way of studying a technology system, and also interesting because at the end of the day, when I was looking at data sets, it was simply like reading stories, which to me is a lot more fun than crunching numbers. And so what happened is that after I sort of got my head around what ethnography was and looking at these field notes, the general process was just narrowing in on my research question, which is looking at what are these other tools being used outside of PHIMS, and then actually looking at the ethnographic field data and doing some qualitative coding around that. So essentially, if you're not familiar with qualitative coding, it's a way of splicing sort of a qualitative piece of data. So if you have an interview transcript, for example, you can take pieces of it and put it in buckets and give it labels. So for example, like spreadsheet could be just a label for any snippet of conversation that's talking about spreadsheets. And then, or you can have more interpretive labels around, oh, I see that there are some trust issues happening. And so you can make those buckets, and that helps you, when you look at all your codes, to kind of come up with themes and look at what are some of the interactions happening within the data set. So it's a way of slicing the data set and then looking at it as a way of analyzing it. So the researcher themselves, like me, is actually the tool of analysis in this case. You're not necessarily running like a Excel query, for example. So that was the general process. And then going into the actual results, unfortunately, I can't speak in too much detail around the actual results of the project. I kind of wanted to sort of showcase that it is quite complex. But essentially what I found is that people were using a lot of things outside of the PHIMS platform. So they were using like spreadsheets and sticky notes, and they were using them for a range of things. They were using them to enable relationships with the school. So some of them would be tracking if a teacher would move from one school to another. So they want to keep a track of their relationships. Or they want to keep a track of the targets. So how many schools have they been able to get to adopt those practices or policies we've been referring to? Or also they're using it for time management. When do I need to contact the school? And the reason why some of this stuff is significant is because PHIMS was designed to be this platform for these health promotion officers to facilitate their implementation, but they've also, there are some things that they're doing that are almost replicated in PHIMS, and there are some things that they're doing that are just their way of personalizing the information and their way of understanding their interactions with the schools. So in some ways we can inform co-design of PHIMS. So what are some of the system improvements that PHIMS is needed? So maybe there are certain things missing in PHIMS that we would take to the technical team. But also at the same time, there might be other things that people are doing that we don't need to touch. That it's okay that people are using things and have their own systems in place in addition to PHIMS, because it allows them a certain level of autonomy over their work. That's the general gist around some of the results, but unfortunately I can't tell you too much around the details. And so just kind of bridging on, that's a little bit about the project. So now moving into some of what are the general big takeaways for me. So one of the things was this idea of what are the challenges of monitoring prevention. And what I mean by that is, we have a healthcare system and we often focus on the consequences of the healthcare system. But how do you measure things like the absence of disease, or how do you look at implementing prevention programs? So PHIMS is sort of one step in that direction, is being able to track how many schools are sort of adopting healthy policies. And so I sort of realized how prevention is in this unique space that has to constantly figure out, how do I monitor, because our world puts so much emphasis on measuring outcomes. So that was one of the things that I sort of started thinking a lot about while I was there. And then I developed an interest in prevention as a field in general, and something that I might want to be doing in the future. The other thing is this idea of ethnography and qualitative data in general. Oftentimes we're so focused on the numbers that I thought ethnography was really cool because it allows you to ask why. A lot of the times it allows you to be immersed in environments, and when you're interacting with someone and you are studying it, like when you're, people will tell you, I use the technology for X, Y, and Z, but if you're with them and you're seeing them interact, you can ask them questions and you can see, okay, what's that sticky note for? And they're like, oh, it has a list of all the things that I need to put into the PHIMS software. It's my template. And you can ask a lot more questions and you can see how people are interacting with the platform, which I thought was quite interesting because you can pick up on things you wouldn't otherwise. And then lastly, this idea of partnership research, which I didn't go into too much detail about, but if you see that there's all these people involved, there's a researcher, the policymaker, you can actually, once we do some data analysis and we do ask those questions, we actually have meetings with the policymakers who design these programs, and we go to them and be like, hey, this is what we found. Does that match up with your understanding of the platform or the programs? And we can sort of negotiate with them what are the questions that they have that they want to ask the data set, and we can go back and look at the data set. So this constant conversation between the researchers and the policymakers and the practitioners, which actually I think in the end of the day produces research that's more relevant and has sort of a direct impact on the policies and programs, because we had a direct line to the people who designed PHIMS and the people who made these programs. So the research that we're doing is highly applicable in that sense, which gave me sort of an appreciation for partnership research in general. And so just to wrap up, because I know that was what I'm just going to briefly kind of say, at the end of the day, it wasn't all work all the time. There's a lot of other things that happened during my QES placement as well. This is the first picture is whitewater rafting in New Zealand, diving in the Great Barrier Reef and hiking. So I did a lot of things outside of my time as well. So I want to briefly mention that. And at the end of the day, I want to leave you with this, is that you can't connect the dots looking forward, you can only connect them looking backwards. And it's this idea that I was working on a technology in Vancouver, like using this technology to track clients and stuff, and I ended up studying a technology system that was quite similar. I would have never anticipated that, and I would never really anticipate what's going to happen next. And I know I will only really be able to connect those dots when I'm looking backwards. Thank you.
And we'll open it up now to the room for anybody who has a question.
So this is a suggestion from my father. He said because I didn't really understand the country as well, he said, okay, so book a place for like a week or 2 weeks, because then you have some place to stay. And then before you make the 3-month commitment, for example, go ask around, learn about the areas, and then based on that, you should make your commitment. And I think that was a good idea, because I actually changed houses 3 times within the first week. And I'm really glad I did that, because the third house I found, I stayed for 2.5 months, and it was probably the best choice. So I would also recommend that too. Very good question, Puru. So in terms of just adjusting to that, I think first off, I'd like to highlight that everyone is very, very friendly, and they do have a really human side of them. So it was really easy to connect when they were cracking jokes about having cookies or just eating a lot, etc. Like, it was a very common joke because in Cape Town they eat a lot. So first, just recognizing that you're a student and the fact that they also recognize that you don't know everything. Aside from that, because there's so many interprofessional meetings, people had different background knowledge, so as a result of that, they did treat me as someone who had a specific objective, so they knew that I was here to discuss my research process, discuss the obstacles I face as well as my point of view, and work alongside them. So viewing myself as a team member, someone with different skills, was one way to accommodate, and also just knowing that because, as others have mentioned, we are there to learn as well, but also contribute, asking a lot of questions, and showing that we're really engaged in the process, as well, the fact that I did all the time to do my research just shows that that I was involved, and it helped me become more comfortable. So it was just like, it's something that you will only know once you actually like dive in, for example, yeah.
Yeah, for sure. I think the one that comes to mind immediately was in Broken Hill. So I guess one of the reasons actually that Broken Hill was chosen as a community was that it does have one of the highest Aboriginal Australian populations there. And so it was definitely, like, I was able to see this disparity between the types of services or even like the way in which the town looked compared it to perhaps like Albany, which was a coastal town. They had a history of like whaling, things like that, so they had a little bit, I guess the financial situation was a little bit different as well. And so I could definitely see that contrast. And then even in my own like personal travels, obviously up to like Sydney and like the Gold Coast as well, which is another community that we were working with. Like I could see the ways in which being more rural or more remote, kind of like in Canada as well, it can lead to certain like inequities in terms of the resources or funding that you can access. And I was especially interested, I guess, in looking into that difference between the Aboriginal Australian population and the larger Australian population. And so that was kind of prevalent, especially when I went into the more rural or remote communities. So,
I think for me, my biggest asset was kind of actually my ignorance, because I didn't come in with any preconceived notions about what things should look like or how things should be. So much of my work before kind of making recommendations, which is part of the work that I did, but so much of it was just characterizing the landscape, and I did that with a fresh set of eyes. And I think that a lot of people who were kind of looking at my work were noticing that I was picking up on things that they had always glossed over because they were just so familiar with it. I was able to look at it in a more critical lens, and I think that was valuable because of the work that I was doing specifically.
Yeah, I would say for me, literally like my time, I guess, like my effort, because the way this project was so fast-paced. When I went there, I was thrown into the middle of this data collection meeting, and I was so lost, and like we were moving so fast through all the different communities, like, and this was a component of work, this literature review that they needed to have done, but there wasn't really anyone to do it. So I think that was like an asset I brought, is that, I guess, that ability to contribute to the team and like do something meaningful, as you were saying. Like, this is a piece of work that they needed and they wanted, they just didn't have the time to do it. So I guess that would be something that I brought.
Yeah, similar to Tamina, I would say just this ability to ask questions, coming in from, again, like a fresh pair of eyes. And for me, what they found really interesting was that they had no idea that I worked on like a health tech startup, and I'd sort of brought in my understanding of like software, and I was like, hey, what you're studying is actually a lot like this thing in business. And they were like, we did not know that. So it was just this idea that you're coming in with your own unique background, and you can point things out and ask questions that they wouldn't necessarily have thought of otherwise. So it's just another diverse person to the mix. When I describe, like, I've tried to describe like what I brought in from other things, and I think it's really not about necessarily content knowledge, but about really just this ability that you come in with to be able to find that information. So the skills you've built up over the last couple of years of undergrad in finding information and taking initiative and sort of confronting those challenges and asking for help are probably going to take you much further than a particular course in the program will.
Yeah, I just want to really kind of reiterate and reinforce that the inquiry process and learning how to ask questions, that shouldn't be understated. You would be surprised at how many people don't know how to ask good questions and don't know how to find answers to them. And it's not about knowing things, but about being able to get to answers, and having kind of those strong research skills. And I don't mean like wet lab research or anything like that, but I mean kind of critical thinking, critical analysis, being able to analyze a piece of literature and understand what it's really saying versus what it thinks it's saying, and that kind of stuff. And all of that, I mean, critical crap, for instance, health Paul, all of those courses kind of teach us those things. So I think Jessica actually kind of was it you? PHIMS, actually, this idea of co-design. So I think in the work that I'm doing, kind of like in health of innovation, both in Toronto and then that I kind of did in Leeds as well, co-design is this idea that the people that are going to build the solutions and the people that are actually going to use them and be the people who are kind of maybe part of the problem, not like the problem, but as in maybe they have that health issue or whatever, they're all together in kind of the ideation phases to talk to each other, to communicate, to understand like what do we want this to look like realistically. When they're left out of that decision-making kind of process in the early stages, that's where some of the implementation issues come in, because when it comes time to implement this, because the clinicians were not there and it was just maybe a bunch of researchers and some I don't know, engineers, they can't foresee certain things, right? And having those perspectives are really important in being able to catch them early on, implement them into the design of whatever it is you're working on, whether it's a policy or a piece of technology, and then that addresses kind of some of the issues that come later down the road.
I guess having a policy window or or political and social environment that is conducive to results, it really helps push the process forward. And just to re-highlight, engaging multiple perspectives, having certain deadlines, and something to really push forward the implementation, I think really helps. So for in my case, we were so limited on funding and because there's no specific committee, it was really hard to implement and push things forward. I think that's where like the policy window or having some sort of impetus would be really useful as well.
I mean, I think with me, so like in terms of scale, like we don't have like a Canadian health system, right? We have the Ontario health system, and the Ontario health system is so much smaller than the NHS. It's just in terms of the number of people working in it, but also the resources and funding available. But I think coming back from the NHS and seeing how, I mean, there's always this joke that the NHS is behind because they're just kind of like this big lumbering organization and they think they're not innovative. I thought they were actually really innovative, and I came back and I kind of took that back to my team in Toronto, and I was like, oh, they're implementing like these types of programs. They have this kind of government support that just doesn't exist here, and everyone was a little shocked. Like they didn't realize that that was the case, and I think that we do have a lot to learn from them in terms of the way that they go about funding and supporting health innovators, which I know is like a very specific thing that not everyone's interested in, but that was something that I took away, realizing that they were a lot further ahead than we were, but just because we're kind of newer and shinier, people think that's not the case.
So I'm cognizant of the time, so I'm going to draw it to a close, and I want to thank all of our scholars again for their presentation. So give them your appreciation. To today's session. That first link that's on the screen right now is the link to our scholarship page. So when we do update it and we announce the application window, that's where you can find it. We will continue to have webinars. So we are at the end of the webinars for the second cohort, but of course our third cohort, all of those students will be conducting webinars in the future when they come back. So look for a series of webinars in the fall, and they also all write blog posts. So all of them write a blog that is posted on that third link, the MacHealthForumScholars.com website has blogs from all of our scholars back to the first cohort. Gives you an idea of the more personal side of things. And all of the scholars that you saw today will have a blog post there as we go along. So thank you for coming.